Okay, so hey, Dr. Stephen Ronan, it's so great to have you here today. Really excited to talk to you about your background and both in medicine, in your personal life, and as importantly in aviation. You fly one of the coolest airplanes out there in the world, the Epic aircraft, and as we just talked about, you got the latest, greatest model, which I'm envious to go fly with you one day. So hopefully we can make that happen. But I would just love to have you start out by talking a little bit about your medical background and your practice.
Okay, so I grew up wanting to be a doctor. Always thought I was going to do orthopedics. Played a lot of sports. Was in a lot of orthopedic offices over the years, and went to medical school with that sort of thought in mind. Started doing research in orthopedics and was really kind of gunning for one of those positions. They're fairly competitive. Maybe even more competitive is plastic surgery, which I thought would be interesting, but the training was ridiculously brutal. I'll just do ortho, it looks just as fun. So when I was in medical school, you could do orthopedic as a fourth year rotation. And third year, you got a month of general and a specialty month of surgery. And so the specialty month, plastic was an option. So I thought, those guys teach you how to sew. I'll go spend a month with there and have some fun and learn to sew, and it'll help impress the ortho guys when I get there the following year. And so by the end of the rotation or that month, I knew I wanted to do plastic surgery, and I was in the chairman's office asking how to get in. And they I guess let me through the back door into the program. So I got into the plastic surgery program where I trained. We actually developed a whole new curriculum, which I don't know if your audience will want to hear about, but I actually designed the whole sort of curriculum. Went through that process. During medical school, also I went to flight school. Just wanted to learn about it, always wanted to do it. And
had a little bit of free time, did you?
Had a little free time. Actually, medical school is one of the more free times I've ever had, actually.
Wow, incredible.
So I worked full time. Drove an ambulance full time when I was in college, and so actually medical school wasn't so bad. And so I did the flight school as well. Went into my residency, which was just an absolute beatdown of time and abuse, and it's like going through special forces training for a long time with no sleep and just constantly being beat on and having to produce no matter what, kind of mentality. And took a break from flying, and then during that time, because I couldn't do it properly, so I came out to the Bay Area where I grew up in Petaluma and started a practice in the East Bay in Blackhawk. Built up, pretty significant practice fairly quickly. Built a surgery center, which we subsequently expanded. I have a pretty big office, like 13,000 square feet, with a surgery center, a couple ORs, 5 recovery beds, probably 20 clinical offices. Pretty good staff. So we've had a really good run over the last 20 years at Blackhawk Plastic Surgery and Blackhawk Surgery Center. And when my kids were in high school and I knew they would be moving away, I started to, think about what I was going to do. I was coaching football and lacrosse and spent a lot of time with them, and my work, of course. And so I knew I'd transition. I'd want something for my free time. So I bought the Cessna TTX and started getting back into aviation pretty seriously, and eventually got the Epic.
Wow.
So that's kind of been my run. Yeah.
And you are flying that single pilot, I take it?
Single pilot. Yep.
Yeah, super high performance airplane. That's really great.
Yeah.
You're one of those rare doctors, I think, that has the exposure to aviation that I think many docs wish they had more, because I personally believe there are many practices in aviation that are being applied to the world of medicine today that are keeping, making doctors and their teams more effective, but also keeping their patients safer. And I'm just curious, are there areas of your medical practice that operate better because you've applied aviation principles to them?
For sure. So much of aviation is more formalized than surgery. I know that kind of sounds weird, but aviation, if there's an accident in aviation today, all the airlines will be part of investigating, or they'll pool resources and examine it, and potentially put out new regulations so that if there's like 2 runways on a V, you'll have to have a closed loop confirmation of what runway you're taking off of, so you don't sort of mess up. And that sort of rigorous application of error identification and how this happened, and what regulation change can we make in our systems to eliminate that from ever happening again, or reduce the chance. So it's very formal. In surgery, we have those processes, but they're a little less formal, and it isn't done on such a mass scale. So for example, there's at hospitals mortality and morbidity conferences where if there's death and complications, it's presented at a meeting, and you talk about it and why something happened, and what could be done different, and it's sort of a learning practice for all of us. But it's a little less formalized than aviation.
Yeah. And how about the reverse? Are there areas of aviation that you brought in? I'm sorry. Are there, have you been able to apply medical training to make you a better pilot?
Yes. So there's a mindset of surgeons that went through the old school training of focus, of like absolute laser focus on what your task is, and eliminating the sort of fuzzy bandwidth stuff, and staying on task, not being distracted, not allowing your anxiety or emotion to make decisions or influence you, but sort of staying like right on task and doing exactly what you're supposed to do. And so that mentality, I think, is very helpful in aviation, because if you do get sort of task saturated, it helps you kind of slow time down a little bit, and process it all fairly quickly, without allowing other influences to kind of like take a piece of your bandwidth.
Yeah.
If that makes sense. So
that makes total sense.
So there's times in an OR when, when you're flying and you're, taking off, landing, or something's happening, you might call for a sterile cockpit, right? And so the idea is like everyone quiet, like no chatter, like we need to put all of our focus on whatever we're doing, right? And
critical phases of flight.
Yeah, exactly. Critical phase of flight. Well, that happens in surgery, where there's times when you can talk and it's leisurely and it's more monotonous, and then there's other times when you really got to focus in and perform, or something's bleeding and you have to stop it, and so there's a time consequence, and so on those times we don't call it a sterile cockpit. We don't really have a formal term. It's like, hey, everybody shut up and like let me work, but it's the same sort of concept, where we have that, but it's not as formalized as in aviation.
Yeah. And it was, I think, Dr. Atul Gawande wrote a book called The Checklist Manifesto, where he talked a lot about aviation principles, particularly around this idea of checklist usage, and talked about the value of those in the medical practice, not just in terms of being more effective, but actually saving patients' lives. Are checklists a part of your medical practice?
For sure. So both, really, even starting before you get in the plane, with your checklist, in both aviation and surgery, there's really an extensive preparation. So you don't just hop on a plane and fly it. And you don't just wheel someone in the OR and work on them for non-emergency kind of things. And so, as a pilot, you become familiar with all the available information, right? And weather and where you're going and the FBO and what kind of fuel they have and routing and all those kind of things, right? And so in surgery, the preparations also pretty extensive. It's like explore their medical background and surgical background and medicines and scheduling and making sure the right anesthesiologist there and team and preparing all the equipment, making sure it's all good, just like your plane has to be checked out. We have to have all the right stuff there and can't be missing anything. And so there's kind of a big preparation that goes before you even, approach the task on both sides. And then in aviation, our checklists are much more formalized, which you kind of eventually develop flows and then kind of go through your checklist at the same time. And in surgery, it's very similar, but again, probably not quite as formalized. So we have checklists that are done at specific times, whether it's preparation or during the surgery, but they're not by the surgeon followed as a pilot would. It's there's different team members that have different types of checklists that they're constantly doing or reminding us about.
Yeah. I'm curious, who's the best pilot you've ever flown with?
Ooh,
and why?
That's a good question. Answer is, well, the funny thing is I haven't flown with that many,
right?
Because I've flown with essentially my instructors and then, some friends and things. So I've been actually very fortunate to work with a couple people that kind of stand out. So Michael Phillips was my instructor for the TTX, and then the after initial training in the Epic. And the guy's fantastic. He's in his early 70s. He's a retired colonel from the Marines and super bright, great guy. Hardcore, he asked, what's your learning style? I said, man, I've been through, you just let me have it, right? I want to be better. And so don't hold back. And so he didn't. And we had a great time. He's very smooth, very slick, very bright. And then with my initial with Epic, I spent some time with Cuckoo, Mike Clark, and he's a retired F-18 Marine pilot. Was also fantastic. I remember my second day of initial in the afternoon, we got on the ground. I said, I'm a better pilot now than I was when I got here yesterday. Like,
wow.
I'm learning so much stuff. It's fantastic. So those two guys, really have given me quite a foundation.
That's great. That's a lot of Marine input. We probably need to get you with some Air Force guys just to round you out a little bit.
I hear it. Yeah, exactly.
I love it though. I've worked with many Marines, and they are always mission focused and so effective at what they do. I mean,
yep.
They're really good at what they do. Well, along that same thread, who's the best doctor you've ever worked with and why?
Another good question. So I've worked with a lot of, now that's something different. I've worked with a lot of great doctors over the years in different specialties. And so, boy, I could tell you stories all night from different sort of legends, in surgery. Maybe the one who had the most influence on me, who was, also, a phenomenal doctor, one of the best, I've worked with, would be my old chairman of plastic surgery. His name's Austin Merhoff. So I started as a medical student. That's the guy I talked to when I said I want to go into plastic surgery, and essentially grew up internship, residency, fellowship in plastic surgery, a lot of general surgery. intern in residency was general surgery. So it was like general trauma, vascular, transplant, a lot of cardiac, a lot of ICU, and then plastic surgery fellowship. And so I went from essentially a baby to a toddler, to a kid, to a high schooler, all the way through this medical process with this guy, and then eventually became a colleague and friend, right? And so he's retired now. He just had an uncanny way of presenting things and making you think about things. He wasn't a hard ass, but he just asked you a question here or there that would, or he'd explain things, very well. But a lot of times he would lead you with some questions and just like make you think a little different, and had a pretty big impact on me. I still, like, in the OR, now I'll think about the things that he told me, and yeah, and just how to do certain technical little things, or why you're doing them a certain way. And so I'll think about them now and then repeat them, to others, and sort of pass it along.
Sounds like he had a technique of not necessarily always giving you the answer, but making you think about it for yourself.
For sure, yeah. And he would ask you questions that, it would lead you to the right place, and then you'd go do your homework and come back and you're like, oh yeah, like, totally makes sense. And I learned a lot more by, doing all of that. So he also had, he'd push you a little bit. So when you're in medical training as a student, intern, resident, fellow, they give you what you can handle. So there's people that are more advanced, can't handle very much, and so if they don't trust you, they just, they're going to be right over your shoulder. Right. But as you develop trust, then, and they know what you can handle, then they're giving you that edge, right? You have like what you know in life and what you don't know, sort of like you have your order and then you have chaos. And the best place to live is right on the edge, because that's where you're learning the most, and you're turning chaos into order. And so the good ones will constantly give you something right on that edge, and it pushes your boundaries, right? So as a medical student, I remember I was doing a tummy tuck with him, and it was just me and him, and we were doing most of it, and he closed one side, I'm assisting him, and I think he had a phone call or something he had to do, like chairman meeting kind of stuff. And he sort of looks across at me and he's like, you think you can close this as good as me? Right? And I kind of smiled. I said, yeah, of course, So, yes, sir. I said, maybe not as fast, but certainly I can do it. Right. And so he kind of says, all right, I'll be back in a little while. And he just took his gown off and left. Right. Wow. And here I am, a medical student. Yeah, like with this patient open, and so I got to close this thing up, and I'm working away, and anesthesia guy, at some point I hear him asking, hey, you want another gram of ANSEF, an antibiotic, and he says it again, and then again. I'm like, oh, is he talking to me? Like, I go, and he like, me? And he goes, yeah, you want another gram of ANSEF? Well, I'm a medical student, I'm not allowed to order stuff, right? He thinks I'm a resident because I'm in there by myself with this,
right,
open it up, and I'm like, yeah, sure, give it, and finished it all up. And he, I did not see him. I'm sure he was right around the corner or right there and peeking at me and, making sure everything was fine. And he came in at the end, checked it all, but it was fantastic. It's like, here we are at the edge, trying to push and get better. And so it was like that all the way along.
It's really interesting. I mean, it just reminds me so much of, and I know you've been through it and I've been through it, but the first time you soloed, the first time your instructor, said, hey, pull the airplane over to the side, opened the door and got out and said, okay, I'm leaving you now.
Yep.
I believe in you. Go do it alone.
I remember doing that. It was at Hanover County Airport. It was a low of 5 degrees and a high of 9. It was snow, everywhere, and the obviously the runway was clear, and we were in the pattern and doing some work. And he goes, "Hey, pull over a second. I got to go get my camera or something. I don't know." So I pull over, let him out, and he goes, "Oh, while I'm doing that, go ahead and do a couple laps."
Wow.
Right. And I was like, okay, and
I
went up and did it. It was, it's fantastic.
just like the doc saying, "Hey, I'm going to leave now. You take care of
Yeah.
that, tying that thing
Yep.
back up."
You're ready. Go ahead. So,
Yeah.
all right. Yeah.
Well, I ask these questions because you are kind of entering into what I think is going to be a really exciting phase of your, both your personal and professional life. You are actively looking into becoming a flight doc for the 144th Fighter Wing of the California Air National Guard, my former squadron, who's now flying F-15. So what's so neat about that is it's going to expose you to aviation in a way that you've really never certainly actively participated in. You'll be flying in the backseat of F-15s, in combat training type missions, and
Yep.
see aviation in a whole different way. Of course, tactical aviation goes from, we're not so concerned about, obviously we need to take off and land and get from A to B, but you become a weapons platform, and all the things that are involved with that, including, G-forces and technology and avionics and weapon systems. And so I think that's super exciting. And of course, you're not going to be doing plastic surgery there. You're going to be practicing a different kind of medicine as a flight doc,
Yep.
which is, keeping our pilots healthy, but really keeping all the troops healthy. And so I just, I'm so grateful for your looking into it, because the United States Air Force, Marine Corps, Army, Navy need people like you to
Yep.
help.
And I appreciate you turning me on to it. It's, I feel, fortunate that I've had a good run in my practice, and that I'm able to, sort of do it in reverse order, and go in and have a great time learning a bunch of new stuff, doing something different, not doing the same thing every day, being able to contribute, serving the country, feeling that need, when they're really down on numbers. And so I think it's fantastic. I can't wait for the camaraderie. I'm very much looking forward to it.
Yeah.
Hopefully the process won't take too long.
Are you selling the essentially? I mean,
What's
it's
that?
sort of like, this is Ted. Yeah. Are you selling the practice? Is that, and then you're going to do that full
Well,
time or
so
part time?
this would be in the reserves, and with my practice, I'll probably have like a 4 to 5 year period where I can kind of go, very part time after 3 to 5 years. And so, for right now, I'd be with the reserves and doing my weekends and my special training ops and those kind of things. And I'm very much looking forward to it.
Wow, you're gonna have a blast. That's awesome.
Yeah.
Yeah. Ted, I can tell you, Ted's jealous. He's an aviation junkie himself. So
Oh, good.
he's jealous.
Yep.
So, there's a lot of statistics out about this, and I think the numbers are changing. You can get different numbers from different sources, but I've heard that approximately 12 lives are lost every hour due to preventable medical mistakes. A, do you agree with that statement? And B, tell me what's going on there.
Okay. So I don't know the exact numbers per hour, but there's I did sort of look, and there's about 90,000 flights a day, and there's about close to 700,000 surgeries a day worldwide. Every time there's an airline disaster or plane, it's in the news. So it's magnified. Whatever it is, it's a tiny fraction, really gets magnified. Similarly with medicine. So when you're talking about those kind of big numbers, 700,000 surgeries a day, you don't really need big of a percentage number to make a lot of cases. So, so that the risks really get magnified. The numbers, you know, get very magnified with the reporting. Some of the differences. So in an airline, you're essentially under ideal circumstances most of the time, right? Planes should be tip top. Lots of people have checked it. Shouldn't be anything wrong with it. Low chance, right? And your crew is well trained in a system. They can only fly so many hours. You know, they have a whole team of people planning and weather and all this kind of stuff. And so it's under pretty ideal circumstances. In medicine, it's a little different. You know, you may be doing surgery because the guy's sick. He's got all kinds of problems. And so the complex machine is not in tip-top shape. You may be trying to save it, right? You may be doing something to, you know, give them a longer life, but they're already, you know, sort of on the edge. And so things are in surgery are absolutely going to happen, you know. With the kind of stuff I do in plastic surgery, which is elective, this kind of doesn't apply as much. I mean, certainly we can have complications like anyone, but in general, we're more like airline pilots with respect to things are typically in better shape, you know, when we go in.
Controlled environment.
Yeah. And so but you know, in certainly in trauma and cardiac and vascular and transplant, you're working with some sick people and you're trying to like make them better, improve the quality of their life. And so you're going to have, you know, more issues. Doesn't matter who you are. You could be the best surgeon ever. You're going to have, you do 100 heart bypasses. You're going to have some people that had a problem, right? So it doesn't matter how good you are, right? So the key is, what are the things that we can do to eliminate controllable problems, right? So, and that's kind of where we put most of our time, right? So we will, there's certain things you can do to prevent blood clots in an OR. So we have all that proper equipment there and we use it all the time, whether it's a 15-minute case or a 3-hour case. And so we tend to focus on all of the things that are controllable and sort of efficient to maximize our chance of having the best result.
Yeah, you know what's so interesting about that, and when I have read these statistics, I recognize that these mistakes aren't all happening in the OR. I mean, I think a high percentage of them have to do with pharmaceutical stuff.
Yeah, that's exactly right.
What's interesting about it is, and you probably know this, in the 60s and 70s, particularly in commercial aviation, and I would say in military aviation, we were also having, I'm going to call it an unacceptable accident rate. And I think you kind of hit the nail on the head when you said, it wasn't because our pilots weren't the best and the brightest. It wasn't because they weren't well trained. It wasn't because we didn't have the best medical technology. In the end, it so often came down to what we call human factors. Just people misunderstanding intentions of each other and not communicating effectively. And so in aviation, we started a program called CRM, Crew Resource Management. And it took kind of an attitude of the captain was God, and no matter what he or she told you, back then it was almost always he, you just said, yes, sir, and you never provided inputs. And so, for example, if you were flying into a mountain and the captain looked over at the first officer and said, hey, go get me a cup of coffee, the first officer rarely said, well, what about those mountain goats out there, sir? He just said, yes, sir, cream or sugar. And unfortunately, lives were lost that way. So CRM basically takes this approach that says the captain is still in charge, but it is always his or her responsibility as the person in charge to solicit input from all available resources: first officer, flight engineer, jump seater, flight attendant, ground crew, air traffic control, to get all the possible inputs and then make the best possible decision based on those inputs. And as a crew member, and I don't mean just a crew member, but as ATC, as a flight attendant, it is always your job to provide input, particularly when you see situations that are making you feel uncomfortable or unsafe. And so I'm just wondering, has this idea of, well, let me go back, because I think CRM has saved many lives in the airlines, and actually we've adopted it in the military too. But has that been adopted to any degree, or to some degree, or maybe to a large degree, in the world of medicine?
So behind on the curve compared to aviation. So surgeons are way less likely to admit fatigue, right? I mean, my record was 9 nights, 10 days, 9 nights without leaving the hospital working, like 20 minutes here, 15 minutes there. When you're young and you do it like that basically every day for years, you kind of get used to it, and you get used to a couple hours a night, and it was all right. You're sort of chronically tired, but there was a mentality of you're not going to say you're tired, right? You're going to perform, like, no matter what. You're not going to forget to do this for Granny Smith on the floor. You're not going to forget to check that x-ray, and you're not going to mess up the surgery. And it was just it was a different time than now. They have a lot of rules about how much you can work now, but it taught us a lot. So part of that training, that the hierarchies were very well established, and everything ran downhill, probably like the military, right? Things just kind of rolled downhill.
Yeah.
And you went through that process. It really depended on the personality of the surgeon. So if you had one that was sort of an egomaniac, then the OR is pretty quiet, unless he's yelling, and people are intimidated and are less likely to speak up. You'd have other surgeons, and I would say this was more common, like my old chairman I mentioned, who was very calm and asking you questions, making you think. And so in that kind of environment, it was very easy to say, you're always asking questions. Why is there a mountain in front of us? Like, why do I see those goats? Like, what's going on there? And, and he said, well, yeah, we're going to turn at that waypoint before we get there, and he explained it to you, right? And so, it was more surgeon dependent as to how much of the CRM was there or not. But it certainly is not as developed as aviation has.
Not standardized.
Not standardized to that extent. Now, there is a standardization process that has happened over the years with, like, outpatient surgery centers and hospitals, where you have different team members that have their kind of individual checklists and are going through, and if there's something missing, then they'll speak up right away because they're sort of responsible for that. And in my OR, it's very calm and casual, and anyone can speak up at any time, and that's very encouraged. But there's still some environments where it's the surgeon's the general or the admiral or whatever, and that's the way it's going to be, right? And so, but in general, I think that's changing over time to a less formal, CRM style.
Yeah. It's really, it's very interesting. And the things you brought up about, in your early days of, 10 days in the hospital, 9 nights. And can you imagine someone getting on an airline or a United Airlines flight, knowing that the captain had not slept in 3 days?
Yeah,
Just would never happen. And
yeah, it
yet
would never happen.
not uncommon in medicine.
I think
it was
something common between the two of you also is, and unlike the rest of medicine, really when you're doing surgery, it's like, sending a couple F-16s out on a mission. You've got a goal, and you're very focused on that goal, and you're getting it done, right? A lot of medicine, the rest of medicine is there's something wrong with somebody. It's more like solving a mystery, and in that sort of mystery context, what I've observed is it's all about handoffs. It's all about information getting lost at the edge between people, shift changes, someone being admitted and things not being quite right. So I think the surgery stuff, it's like you're trying to make a repeatable process with the checklist and all this other stuff, but the rest of medicine is just, it's like super complicated and not reproducible often. So I don't know, it just seems different.
Yeah, I'm biased, towards surgery, but I think our systems are better than the rest of medicine. We're more contained. Like that patient is contained in an OR unit, and it's very complicated and very detailed. But I feel like there's a lot more of the communication you're talking about. Less likely bad things are going to happen for those reasons, as opposed to out on a floor somewhere in the hospital where you're, it's not as an intensive focus on you, you're just there on a team of people. Interestingly, like what I do every day, faces, noses, breast, body, hair transplants, that's sort of like being an airline pilot where everything's at sort of optimal conditions, and you're going to go from A to B, and and almost every time it's going to be pretty routine, right? And you might have to make a couple changes along the way, but in general, it's pretty straightforward. Where the kind of surgery I used to do in training, or something happens, then it's sort of more like the fighter pilot conditions where you got your equipment and that works, but you're in suboptimal conditions. You may not be able to see very well. There's lots of unknowns. There's risks lurking out there, and really more maybe pressure at that point, and potentially anxiety and those kind of things. And so, if you're doing transplant surgery, you're more in the fighter pilot zone. Or if you're doing, some of the trauma surgeries or things that we would do, you're sort of more like a fighter pilot. But the things that I do and most of the routine surgery would be more like an airline.
Yeah. SFO to LAX.
Yeah.
Probably going to go pretty well.
Yeah, exactly.
It's interesting, Ted, though, you bring up this point about, and I know you have this recent experience because of both your mother and father spending time in the hospital. But, this is one of Gawande's great points, is that if you do standardize these handoffs, was one thing you brought up. If you use checklists and people live and die by these checklists, the handoffs do go more smoothly. The information is communicated correctly, and nothing is missed. And, I think both Stephen and I would agree that as you use checklists more and more, you develop really good habit patterns, and you're able to do many things, we call them normal procedures, by memory. But what I've learned, and I know Dr. Ronan probably knows it as well, when I'm maxed out, when I'm not thinking clearly, when I'm behind, that's when I need to pull that checklist back out for my normal procedures again, because I know I've only got 2 minutes to get this handoff done, and I want to do it right, and I'm not thinking clearly. So let's use that checklist and make sure, okay, we've talked about this. Ooh, I missed the third thing. So glad I looked at my checklist. Now the handoff's complete. Now the patient is probably in better care than they would have been if I just tried to wing it. So
it's not about me, but I just have to say, I mean, putting up ads on Google, I mean, I have a checklist. It's like 30 points. And if I miss any of those points when I'm putting up a campaign, Google's going to take your money hand over fist and your campaign's not going to do that well. So I can completely 100% relate.
yeah, that's a great example. Well, you're a perfect straight man too. Talk a little bit about technology, Dr. Ronan. How has technology impacted your business and your specific field of plastic surgery?
In lots of different ways. So I don't know, you probably don't know this. I'm the medical director of one of the largest aesthetic laser companies called Cutera.
Oh,
So
what's the name of the company?
Cutera, Cutera. They're out of Brisbane.
Okay.
And so I basically am usually the principal investigator of most of the studies, and will help work with the R&D team and then the clinical team on really the development of products, the research on them, development, the clinical process to get them approved, through the FDA, commercialization of the products. And so a lot of these technologies have had or will have a big impact. So for example, our latest is a laser that cures acne or significantly reduces it.
Wow. Wish that was around when I was 18.
Yeah. So think about what so many people go through with years of the medicines and the Accutanes and maybe some acne scarring and or maybe being made fun of or whatever other sort of tortures people would go through. Now you can have, 3 laser treatments that take 15, 20 minutes and have most of it gone. So that's a new technology that is just sort of rolling out and hasn't really hit the public that much yet, but one that we're pretty happy with. Other kinds of technology, we have technology now to go after reds or vessels on your face or body or brown spots or wrinkles or texture or tightening up skin. And we have sort of all these great technologies that have really expanded the way that we can help people. So that's, pretty fantastic. In the OR, we have like newer ways of keeping people warm and, more advanced anesthesia machines. It's sort of like more advanced avionics, that can do more and give you more situational awareness. We sort of have that with some of our technology now. The medicines keep getting better, so they'll make things that have less problems, less nausea, kind of wear off faster, so you can kind of give it to them and have them wake up quickly and be alert and oriented, very quickly after surgery. So there's like a whole variety of technologies that are impacted us, pretty regularly.
Yeah, well, and just like in aviation, I mean, certainly in tactical aviation, but I'm sure flying your airplane as well, you got to stay up to speed on that stuff because I flew for the airlines for a while too, and they kept upgrading our software, and I can't tell you how many times I looked, either me or the captains go, what's it doing now? And you think, well, that's not how it's supposed to be. We're supposed to get this stuff. So, well,
the good news is that you were picking up on it.
Oh, right? Yeah. And
that's what you gotta, and it's the same thing in surgery, right? Is when I'm working, like my zone, like almost all my attention is on this spot where I'm working, and someone walks in the room, I don't stop. Hey, how you doing? Like I can say, hey, how you doing? But never come off my, zone of attention. And, but at the same time, you're have like one invisible eye going everywhere, watching everything, why is that door still open, or whatever. And pointing out where your automation, like, is not doing what you want. Right. And so it's a very similar sort of thought process that goes on of I know it's programmed, but that's not right. let's fix this.
Yeah.
Yeah.
Well, that, and I think for pilots, and I'm sure for doctors as well, becoming too reliant on the technology can be very dangerous. And,
Yep.
in those situations where you say, what's it doing now, or it's not working the way I expect, you need to know how to override it, shut it off, and just go back to flying, the way you learned in Cessna 152. And, I think you never want to lose those skills. If you become too reliant on technology, the technology can actually fly you right into the ground before you know it. So I think it's super important. Doctor, we've only got about 10 more minutes, and I know you had some things that you had prepared or that maybe I hadn't covered. And is there anything you want to talk about right now before we wrap up?
One of the things is simulators. So,
yeah,
right, simulators. And
so powerful.
Epic just built an Epic simulator, which I got to use for my recurrent training about 3 weeks ago. Flight simulators are fantastic, right? That's this giant room with HD screens, all the way around, an actual cockpit set up exactly like the plane with the avionics, the whole thing. There's a server stack of like 20 servers running this simulator. It's absolutely fantastic, right? And you can do commercial checkout rides in a simulator in aviation. You can do, lots of training in them. And one of the things that's beautiful about them is you can do things in a simulator that you'd never do in an actual plane. It'd be too dangerous, break things, put you in, situations that you would never want to go into, but maybe you should have experience in. And fantastic on aviation with that. Our simulators are not so good and really harder to do. It's we can't build a fake human, right? So and then do these surgeries and then undo it and just like start it over, reset it, and we'll do that again, right? Until you get it down, right? So it doesn't work like that. Well, we have cadavers and we use those, for some surgeries. And if you wanted to try something new, you might try it on a cadaver, or you might have a visiting professor and he or she might take you through some complicated surgery that they do on a cadaver so that everyone can see it and walk around and touch it and play with it. With laparoscopic surgery and the robotic, those sort of tend better to simulator or simulations and are pretty good, but they're not like aviation simulators. And it's going to be a long time before we catch up. Because you'd have to make like essentially a avatar, like a avatar person that we could work on, right? So that's
3D, right?
We're nowhere close to anything like that. But that is definitely something aviation has. It's a tremendous tool. I in doing my initial, they didn't have the simulator. My recurrent, they did, and just going up and having them, kill the engine and just different things, fires, and
failure,
all kinds of stuff. Yeah, it just was. And what's interesting is because we talked about checklists, right? And you're up there, and the engine goes out, or electronics or this or that, and you have time to, first thing is like, I'm gonna take a deep breath, shit, and then you get your checklist and you start doing your memory items.
Yeah.
Get those started, and then you grab your checklist and you go through every single thing, and you have time to do it. But the simulator is, fantastic for, drilling all that kind of stuff.
Yeah, I love simulator in aviation is amazing. The other thing I learned about simulator is, particularly in the airlines, but also in the military, when you're not flying, you often get to watch someone else fly.
Yep.
And watching other people in the simulator is so useful because you learn so much from other people's mistakes and other people's, excellent best practices. And, you're not in the moment. You're watching, from a God's view above.
Yes. Yep.
You're like, oh my gosh, I could have made that mistake 100 times. Thank
That's
God.
exactly right. You don't have any bandwidth into knob turning and button pushing, right?
Yeah.
You're just
you're lasered
like
in, like you talked about.
1,000 feet watching and seeing things develop and not spend any of your time on the details. And then it's like, oh, what is this guy doing? Like now I've done that,
Yeah.
and you can see it all coming. And it's the same with surgery, because you really spend a lot of time growing up watching, and at first you're just like happy to be in the room, and then you're scrubbed in, and you're holding a hook, and then it's little by little more and more, with depending on like your comfort level and trust and all that kind of stuff. But you spend a lot of time learning by watching people, in surgery.
Yeah. How about other stuff? Any other stuff you have on your list there that you wanted to talk about that we didn't cover?
We covered most all of it, I think. Yeah, we covered a lot.
Yeah, really. I mean, super, super fun talking to you, Ted. Anything we missed on your end?
I think the only thing would be, we talk about technology, but there's this fear, I think, on the aviation side of being replaced, right? With this, loyal wingman stuff and all that.
Yep.
Do you see, surgery as being, 100% robotic at some point? You guys are out of a job, or you're just
long time
preparation guys, or what?
Long time, I think, before that's going to happen. I'm sure that there's going to be some things that'll be robotic. Okay, I can give you examples of things that are happening. There's a robot that we use for hair transplantation that can harvest grafts. So that's happening today, right now in my office. We don't use it all the time, but the technology is very good to remove grafts. It's coming, it's in process, not quite as good yet, where it can place them. There's going to be robotic technology running some of the lasers that we do. So you might have a robot doing laser hair removal for you or something. So that some of that's here now and on the horizon. As far as doing surgeries, I think that's going to be a little while, because of the sort of complex and abstract thinking that has to happen, in the moment while you're doing these, procedures. So It might be a little while.
Well,
Cool.
I want to be sensitive to your time, doctor. I can't thank you enough for taking the time and also, just sharing all these great ideas and what you're about to do with the military to, really giving back and hopefully getting a little as well, because I think just knowing you the way I do, the first time you jump in the backseat of an F-15, it's going to change your life. And
can't wait. I'm looking forward to it.
I know. So I'm looking forward to keeping in touch, and thank you for your time today. And also congratulations with the success of your business. It sounds like you've really built an incredible practice, and we didn't get to talk about it, but it sounds like you are in a phase where it may grow very exponentially over the next several years. So congratulations on that.
Definitely. All right. Well, thank you so much. I appreciate it.
All right. Thank you. Have a good night.
All right. Bye-bye.